Hello, Chicago. Hello, Chicago. Thank you. And I want to thank Technori for inviting us to present to you tonight. My name is Star Cunningham. I'm the founder and CEO of 4D Healthware. Let's get right down to business. How do you take your health to the next level? If you own a car, if you've driven a car, it comes with a manual. And it also comes with a lot of preventative maintenance that you do to that vehicle. You spend the money to do that preventative maintenance, so you're not the person that's stopped in the middle of the Dan Ryan during rush hour. Now, those diagnostic systems for cars are becoming more and more sophisticated. But what about our bodies? Do they come with a manual? Do you practice preventative care for your body in a way that you know that what you do impacts your health outcome? Do you even know what that means? Well, right now today on the market, there are multiple medical devices, a plethora of them. Some of you may be wearing them now, Fitbit, Nike Fit. You may have heard of Zeo, help you sleep. In addition to that data, in this room right now, every individual is throwing off important data. Your stress level, your emotional well-being. How was your commute this morning? Did you have a good lunch? What are you planning to do tonight? Where is that data going? Is it being analyzed anywhere? Can you take it into consideration as you plan your activities? Not just today or tomorrow, but for the rest of your life? Who are we? We're 4D Healthware, and we are here to empower you to save your own life. Just a few months ago, I went to my primary care, and I had a low iron level, anemic. So he prescribed iron, naturally, because that's what you do when somebody presents with anemia. 3 days later, I was in with my gastroenterologist, very sick. In the same medical facility, he said to me, something happened. You were here 3 days ago and something happened. I said, I saw my primary care, but something happened. Oh, he prescribed iron. That's it. Stop taking it immediately. That was on a Friday morning, 2 days after my appointment. Had I gone through the weekend, because I have Crohn's disease and I suffer from short bowel syndrome, my condition could have turned very quickly. Just like you, I put my faith and trust in all of the things that the medical system says. We have integrated electronic medical records, and they are designed to help you. But if we aren't more active, if I'm not more active, if you're not more active in the decisions that you make regarding your care, we're all going to continue to be at the mercy of the medical system. Now, what do we do at 4D Healthware? Not only do we collect information, but we also collect a richer stream of information. I mentioned some of those things to you that doctors don't ask about. We collect it more frequently than once every 6 months or once a year. And then we also get into genome science, biochemistry, and DNA. So tonight, we invite you to join us, to sign up. And if you do so in the next 24 hours, you'll join a platform that's going to allow you to take your health to the next level. Thank you.
Just a little side note, 'cause this is actually this is like closing a loop here. So I first met you over 2 years ago.
Yes.
And you were like, I just quit my job. I want to be an entrepreneur. And so it has been crazy to watch from there to like now you're actually on stage, and it's been kind of fun. So
it is
it's nice
surreal.
to someone who took the leap and left the corporate world. So.
Thank you.
The first question people want to know is, are you a doctor?
I am not a doctor, and that was one of the things that kind of held me back. As Seth said, I quit my job, but I had a lot of experience with data and technology, and I went and tried to offer my services and skills to the healthcare sector, and they said, we like you a lot, but you don't have 10 to 15 to 20 years of healthcare experience. So I left and decided to start my own company. I'm not a doctor, but I know a lot about data, technology, and solving problems. And that is what the healthcare problem is about.
Okay. There are lots of dashboards out there. Is it better to attach to existing health sites, or do you feel like the better route is to go with the Fitbits and gather all the data that way? I guess they're saying data from all sorts of disparate sources is difficult. Is that the challenge that you're trying to accomplish, is bring it all together?
Yes and no. The yes part of that question is because our platform is agnostic, whatever device you bring to the platform, we're able to draw data from it. But that's to make it easier for you. So you don't have to go in and enter how much water you drank, how many miles you walked. It's less cumbersome. When it comes to medical devices, a lot of those are wireless and feed data as well. So again, making it easier for you. But we also will have those relationships with people who will feed us data directly. There are some things that can only come from an individual, and we will be asking you to type that data in. So to answer the question, yes, we're willing to connect with any device from anywhere in order to have that data help you.
Okay. I know we didn't see any screenshots or anything up there of it, but can you explain a little more about what 4D Healthware is when you interact with it, what you're going to see?
Absolutely. So imagine when you walk into a healthcare facility, you have in your pocket or on your smart device something that you rarely leave home without, a complete healthcare record. Whatever doctor you're going to, you can actually select and build a dashboard around information that they may or may not have access to about, for example, having short bowel syndrome or having some type of allergic reaction. Right now, when you go to sign up for our services in beta, it's an opportunity for you to fill out those first 2 pages that you fill out when you go see a doctor. And that's where we begin with the first step of your data. And then we're going to take that information and begin compiling it with research, white papers. I'm not a doctor. We do have doctors on our team, as well as practicing nurses and a complete medical research staff that will be going through and analyzing the data and making personalized recommendations for how you can change your lifestyle. Of course, you do nothing without your physician saying that that's okay for you to do, but there are things that you can do that impact your life on a daily basis now that we will be able to encourage you to do more of.
Okay, and I guess just one last question. So you mentioned DNA, human genome data. I know it is a little pricey to get that. Are you going to be working with those providers to get it at a lower cost, or is there anything going on there? Or?
That is a very good question, and the answer to that is yes.
All right, that's fine. A little secret sauce there, but all right, that's actually all the time we have, and thank you very much.
Thank you.